From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Today, we're diving into one of the hottest topics in health right now, GLP-1 meds like Ozempic, Wegovy, and Mounjaro. While these medications are getting a lot of attention for helping with weight loss, taking them is only one step in the journey. That's why I'm so excited to be joined by Tara Schmidt, a registered dietitian and instructor of nutrition at Mayo Clinic, as well as the lead dietitian for the Mayo Clinic Diet. Tara is also a podcast host, medical editor, and author passionate about reducing weight bias and educating people about realistic, evidence-based weight management. Today, she'll share practical tips on how to eat well, track your progress, and stay on track without feeling overwhelmed. Whether you're just curious or already using GLP-1s, this episode is for you. Let's get into it. Hello, Tara, and welcome to the Care Experts podcast. We're so thrilled to have you here today to talk all about GLP-1 medications.
Hey, Erin, thanks for having me.
To kick things off, let's just start with the basics. What is a GLP-1 medication?
So when we hear the phrase GLP-1, we are talking about glucagon-like peptide 1. And this is going to be a medication. You can also add receptor agonists if you really want to get fancy. These are going to be medications that are mimicking a hormone that we all naturally have in the body. So we're giving this to kind of boost something that we all already have.
What are the most popular GLP-1s out there? I know that most of us have heard Ozempic, but are there other brands or types that people are using?
Yes, and there's always going to be kind of two of everything because the FDA has some of these doses approved for diabetes. This is really where they came from beginning. And now different doses are approved for the diagnosis of overweight or obesity. So we've got Saxenda and Victoza, Wegovy and Ozempic, Zepbound and Mounjaro, more to come.
How do these GLP-1s work in the body to support weight loss, healthy weight, appetite?
Yeah, so they're working in a variety of our organ systems. First off, in the brain, they are decreasing some of our appetite signals, so we truly have less physical hunger. We also have less cravings, or you may hear people describe it as food noise, which I absolutely know what that means because I think I have that. They're also working in the gut. They're going to slow down what we'd call gastric emptying or gut motility. Food is going to stay in your stomach longer. And when food is in your stomach and your stomach's a little bit stretched, I do this with my hands, that's the signal to your brain that you're full because you're physically full in the stomach. So they're keeping food in the digestive system longer, which helps us stay fuller longer. And then from a diabetes standpoint, we have these helping in the pancreas and the liver to manage blood sugar better, keep those blood glucose or blood sugar levels at a healthier range, stimulate insulin secretion, all of the good things. And again, that's why they started out as diabetes medications.
If somebody's thinking about taking a GLP-1 medication, how would they know that it's right for them? How do you determine if you're a good candidate?
Yeah, this is, of course, an important conversation to have with your medical provider, but there are medical guidelines. So, for example, there's currently BMI and comorbidity or diseases associated with obesity. So there's some guidelines to whether or not you're an actual candidate. But from a more personal standpoint, I talk to my patients and members about how much weight they intend to lose or need or want to lose. Are they going to be familiar that this is a long-term game or solution, not hey, I've got a wedding coming up and I want to look better in my dress or in my tux?
Yes.
Are there different pathways that might suit their weight loss goals better, like lifestyle, but all the way up to bariatric surgery. So we really
Mhm.
look at that person as a whole, their weight loss goals, their health, of course, their medical history. And we have lots of pathways for weight management. This is just one, but it's certainly a booming one and a popular one at the current time.
When somebody decides to take a GLP-1, is it almost like a Band-Aid that they're putting on? They can focus on that and don't need to focus on anything nutrition and lifestyle-wise? Or do you recommend taking a more holistic approach?
I absolutely recommend taking a more holistic approach. And that is how these drugs were studied and how they're meant to be prescribed. They're meant to be prescribed with a lifestyle program alongside. Does that happen all the time? Of course not. But we have to
Mm,
keep in mind that even though these drugs are honestly as magical as they are in really helping
yeah,
people to decrease their weight, weight or excess weight is not the equivalent of health or unhealth. We have body composition to consider, we
mhm,
have other diagnoses to consider. I need you to be well nourished. I need you to be hydrated. I need you to be losing. You're always going to lose both fat and muscle and even some bone when you lose weight in any aspect of
right.
weight management. But I'd love for you to actually use this time with a tool like a medication to be able to focus on the lifestyle changes.
I have heard from several individuals who've started a GLP-1 that they say it really is the catalyst that makes them feel comfortable doing things where they've held back because of their weight. So all of a sudden they feel like I can go to the gym right now. I feel a little bit less insecure about showing up at this place or that place or putting myself out there, even socially. And
Yeah.
so it can support one avenue of our health and wellness that ultimately may open up the door to other areas that support our health and wellness as well, which is really beautiful. What can happen if someone doesn't change their habits while using a GLP-1 and they continue doing everything that they were doing, but they're using the GLP-1?
We have considerations for nutrition, right? So you can have excess weight, or you can be a normal weight, or you can be underweight. Again, these are medical terms I'm referencing, and still be malnourished. So, I, as your friendly neighborhood dietitian, care about nourishing your body, making sure you're getting enough nutrition and the right kinds of nutrition. There's absolutely a concern with body composition. We know that there's a higher percentage of lean mass loss with these drugs. So people are losing muscle mass more than they are with, let's say, lifestyle interventions because of how rapid it can be. So we really try to counsel people on how to limit that lean mass loss as much as possible and weight regain. If you are on this medication, still doing your old lifestyle, and then you go off it for whatever reason, we're
Yes.
likely to be back at square one because you didn't utilize the time on the medication to really change your environment or your habits.
Let's talk a little bit about what a healthy day on a GLP-1 would ideally look like and what some of those habits that someone could start to form while they're taking it in order to ensure a sustainable plan for the future.
It's going to look like a healthy day for everyone, but the things that we focus on are adequate protein, adequate fiber, slowly introducing or upping that, adequate hydration, strength training, especially. And like we
Mm-hmm.
talked about, how can we use this time to adapt your environment? Maybe it's your pantry, maybe it's how your day is structured to help you get to the gym. Maybe it's how often you socially eat out and how to have that conversation with friends or family about supporting you in this lifestyle change. But nutritionally, there's a few key components, like I mentioned.
If somebody is taking this right now and they're like, I know I need to make some lifestyle changes, I need to change habits, but they're almost stopped or stalled because it almost feels like too much. Where would you recommend that somebody starts in creating that healthy lifestyle? Like, is there one thing that's more of a needle mover than anything else?
We can combine a few of them in one. So, an example would be we know a lot of people are under eating on these medications because they really have no
Mm,
hunger. So, sometimes they're forgetting to eat or they're kind of capitalizing on the fact that they don't have hunger, but then they're not meeting their nutritional needs. So, I would focus on something that's a triple whammy. Like, I can get you a protein shake or I can make you a smoothie. I'm going to
mm,
get you some calories in that. I'm going to get you some protein in that, and I hydrated you. But it's just drinking a protein shake. So that's not as overwhelming. You're not going to be
yeah.
full. You're not shoving a salad down your throat. So there's a few things we can do to combine the aspects that are important.
I love that. Starting with a daily protein shake is so doable,
Yes.
perfect. Now, I have heard of some people experiencing side effects from GLP-1s, whether it's
Mhm.
constipation or nausea, fatigue. Is that common? And what should somebody do if they're noticing that themselves?
It is very common, and it's most common when people start the medication or as they're titrating up. So many of these medications, you start on a dose, and then over 6 months' time, even for some of them, you're increasing the dose gradually. And when you have that dose increase is when you're going to experience those symptoms most often. They tend to be more manageable with time. So know that you're not likely to suffer the entire time you're on it. But what we counsel people on is learning about the appropriate portions of food and
Hmm.
what a portion looks like for you now, about even the texture of food. So people who are really feeling unwell tend to do better with liquid or softer meals. Again, here's that protein shake or smoothie. Bowel habits tend to adapt over time. Sometimes we got to up the fiber, sometimes we have to
Yeah.
decrease it. We often increase hydration. Dehydration is causing some of these symptoms, and some of them are just weight loss symptoms that we actually would see on any weight loss pathway and are not specific to the medication.
Interesting. If somebody has struggled with yo yo dieting in the past, how can this approach be different?
This can help them do things a bit less dramatically, if I can say that. So when someone has a history of yo-yo dieting, they tend to make big leaps. It's Monday, I'm doing this diet that I saw on the internet.
Mm-hmm.
It's January 1st. Let's clean out the pantry with a big black garbage bag. With these medications, because your hunger is so decreased, it gives people a little more wiggle room to slow down and make ideally gradual lifestyle changes, adapt their environment gradually, build their exercise routine gradually, and hopefully avoid that yo yo or those regains.
How does the Mayo Clinic diet support individuals in this more holistic approach and creating these sustainable lifestyle changes?
So, because we're an educational institution, we of course have education written or in video form about things like managing your side effects, how to get enough protein in, what would be a good meal example for someone who's struggling with nausea. So we do it via education on the actual platform. We do it with support. So we have group coaching, myself included, but also the opportunity for one on one dietitian support. We also have a community of our members, and it's kind of that peer to peer support, not expert to
Yes.
patient support, where we call it the happiest place on Facebook because these are members of the diet talking amongst themselves. Hey, the 4th of July is coming up. How do you guys think you're going to manage eating healthy? Or how do I tell my aunt that I'm not
Mm.
going to eat her famous pie this year? So it's really talking about those real life scenarios, and peer to peer support, seeing it from the outside is just so cool because they've developed their own community because of their shared experience.
It sounds like a really supportive environment that is built on long-term sustainable changes versus some of the diet culture world where we see these big shifts and changes and it can become quite toxic. And so
Yes.
I love hearing that you've got this available for individuals because that community support and peer-to-peer support is so valuable as well.
Yeah, I agree.
Now, one thing that somebody may be concerned about starting a GLP-1 is what happens when I go off? Am I just going to gain all the weight back? Can you talk to us a little bit about that?
Yeah, there's a risk. So if you think about any drug or tool that you're using for chronic disease management, so I always
Mm-hmm.
give the example of blood pressure. If you have chronically high blood pressure and you require a medication for it, and all of a sudden you stop taking it, your blood pressure is going back up. That's kind of just
Mm-hmm.
science. So that is true, unfortunately, at this point in time of these medications. About 1 year after drug cessation or stopping the drug, people have typically gained anywhere from half to two-thirds of their weight back. So, of the weight that they lost. So, there is
Okay.
absolutely a risk there. And that's why it's important to consider this as a long term tool or a long term medication or a medication for a chronic disease, because although you're at a lower weight than you started, of course, weight cycling, or like we've been talking about, yo-yoing,
Yes.
is actually unhealthy. And there's even some health risk to yo-yo dieting or weight cycling.
Now, if somebody takes a GLP-1 and they work on their habits and they work on their emotional safety and this variety of things, is that statistic still the same? Where, if they're now going to the gym regularly, they've reduced stress, they have including more variety in their diet, is it as likely that they will gain the weight back? Or is that more if you're taking the GLP-1 and doing nothing else?
I think it's going to be correlated, of course, with the amount of lifestyle changes that you're making, but
Yeah.
also know at no fault of the patient, you are going to have a return of the appetite that you're used to not having. You're not
Yes.
going to have the delayed gastric emptying that's keeping you fuller longer. So, this is in no way a fault of the person, but we took your tool
Mhm.
away, right? And same with the blood pressure example. Even though you're doing the DASH diet and you're not smoking and you're managing your stress and you're exercising, you're still at risk of your blood pressure going up.
Let's move on to some questions from our audience for our Ask Me Anything segment of the podcast. The first one is I've been on an Ozempic for 3 months and have been doing really well with my weight loss. But lately I've noticed I'm a little more tired and sometimes I feel lightheaded. I'm trying to eat enough and stay on track. Could it be a sign that I need to add something to my diet or take something away?
Fatigue is a common side effect of weight loss in any spectrum. So know that that's going to be possible regardless of the method of your weight loss. So it's there. What I would do as your dietitian is check that you're eating enough. And again, this is not uncommon that people simply aren't getting enough calories. They may not be getting enough hydration. Fatigue can be a side effect of dehydration. Are they getting enough movement in? It's very counterintuitive, but I promise that movement can help with fatigue.
Yes.
Lightheadedness has also been documented. And keep in mind that some people may need to go see their primary care provider to get off some of their medications, which is great, right? So maybe you're on a blood pressure medication because you previously had hypertension, but now it's much better controlled as a result of the weight loss. We may get to cut your blood pressure medication or take you off altogether, which is always a huge win. So, a few things nutritionally, but also medically to consider.
Amazing. I've heard that you're supposed to eat more protein while on a weight loss drug like Ozempic. Is that actually true?
That is true. We want you to have, I like to say, adequate protein because there's a lot of misinformation out there about the math about how to calculate someone's protein. It is not one
Yes.
gram per pound. It's actually 1 gram per kilo, which is about half of what you are in
Mm-hmm.
pounds. So, adequate protein, yes. And you don't have to do math. I promise. You can think about 25% of your meal, right? So about a quarter of your meal, or if you wanted to do 25 to 30% of your total calorie intake, or we can get rid of numbers completely and say, I want you to have a protein source with all meals and all snacks. That's good enough for me.
Love that. Is the connotation that when you're choosing some protein or from a meat source for your plate that about the size of your fist, is that still true? I mean, obviously that's not
Close.
precise, but
Palm.
okay. The
Palm. So
palm of
think
your
of
hand.
height, width, even depth. So yes, my husband gets a bigger steak than I do. He deserves it. He's a bigger guy
Okay.
than I am. But yes, palm tends to be appropriate.
And this is, of course, just a guideline. Your appetite may change throughout the day, so you don't have to follow it precisely, but it's a guideline. Love that.
Yes. And if you're on a GLP-1, you may find protein sources that are more easy to digest and therefore tolerate than animal protein. So a shake, a smoothie, some tofu, some eggs, some yogurt versus animal protein, which is going to just take longer, of course, to break down in the stomach.
Yes. Can GLP-1s be used as more of a short-term reset to kickstart losing weight? Can I stop them once I've hit my goal, or are they really something I should use for long-term weight loss?
I'd like people to think of them more so as longer term medications because of that risk of regain. So, a conversation, of course, to have with your medical provider.
Amazing. Well, thank you so much for sharing your wealth of knowledge on this topic. It was a pleasure to have you here today.
You're very welcome. Thanks for having me.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.